Hello, everyone. Welcome to our second session of Taraba Image program. I'm sorry to announce that our main host, which is Deborah Dennis, is unavoidably absent at the moment, but we hope she joins us before the end of the session. So I'm going to give a brief recap of our last sessions. Before then, I would like to appreciate our special guests. I'm not going to mention their names now, but you can see them. So we have a lot of packages for you to learn from. So I welcome you all for our on our wonderful sessions. It is our pleasure to welcome you back again to our monthly community dialogue. Last month we had our first virtual session where we discussed how Taraba youth can leverage their skills and potential for societal impact and development. We touched on mentorship, optimizing our use of technology and social media, and legal aspects of engaging with our community. I'm supposed to be here with Onoja, who is my co-host as well, but he's not here. But before he comes, I would like to introduce you guys, our special guests. So I'm going to start with the doctor. Please, can you tell us your name and
Okay,
why you're
good
here?
afternoon, everybody. Can you hear me?
Yeah, we can hear you.
Okay, my name is Dr. Militus Prince Joseph. The Militus is actually my surname. The Prince is my name, and Joseph is my grandfather's name. I'm a medical doctor. I'm a clinical gynecologist, an obstetrician. I work with Federal Medical Center Berlingo. And thank you for having me on Image Taraba. We hope to have a nice and great outing together. Thank you for having me.
Thank you. It's a pleasure to have you here. So, to make sure we're all in the loop, our session today is the role of community support in mental health. And like I said earlier, we have a special guest, the doctor, our expert teacher, and of course, a psychologist. So, over to you, Zainab.
Speaking, and when they say over to me, that's when my network decides to. Can you hear me?
Yeah, we can hear you.
Okay, my name is Zainab Yusuf, and I am a teacher. And well, and hopefully an ADS consultant. I teach right from ADS, which is nursery, to secondary. Yeah, that's all.
Yeah, thank you so much. It's a pleasure to have you here. So before I was introducing my co-host, Onoja, who is Onoja. Please, can you tell us your name and
All right. It's good to be here. My name is Samuel Onoja Oguchia, and I'm a music artist, a brand strategy, and a project manager. It's good to be here. And sometimes I teach just like Auntie V said. I teach and then I follow up with Terah's work and all of that. So it's good to be here.
yeah, it's good to have you as well. Thank you. So before I was
Thank you.
saying on our talking about our last session, which one of the main points we highlighted is for the youth of Taraba State to take advantage of every opportunity they have and ensure that everything they do is within the legal framework of Nigeria so that they don't get into trouble with the law. So, the psychologist, I'm going to hand it over to you to introduce yourself before we go on to introduce all of you fully. Tara, can you hear me?
I had a
Tara,
little. I had a little glitch with the internet. Hello, everyone. Hello, viewers. Good afternoon. It's a pleasure to be here. My name is Terah Micah Barde. I am a clinical psychologist as well as a mental health advocate. So it's a pleasure being on this event to discuss about mental health, which is my core. Thank you very much.
thank you so much for being here, Tara. So I'm going to hand it over to Onoja to tell us the main objectives of why we are here and the main objectives of the role of mental health. Onoja, can you hear me?
All right. Can you all hear me?
Yeah, we can hear you.
Yes, can you hear me?
Yeah,
Hello. Yes. In
Go
one
ahead.
yeah, we
We can
can hear
hear
you.
you.
one of the reasons we're having this section is to, create a significant, you know, mental health is very important. In fact, it fosters the growth of every environment or every country or every state. People lack sometimes because of stigmatization and discrimination, we tend to avoid people with mental health. But one of the reasons you see certain countries grow ahead of our country or ahead of our state is they pay attention to people with such health. Sometimes you don't get you need to understand why are those people acting this way, why we need to pay attention to them because tomorrow you don't know who is supposed to be who. So one of the reasons we're having this section is to create an awareness on our own role as a doctor, as a medical personnel, as a teacher, as a music person, as a lawyer, wherever work you find, wherever niche of work you find yourself. How do we come in to help people with mental health? We have people that are mentally unstable in our areas. How do we come in our little way? Sometimes depression can lead to mental health, right? Depression can lead to that. Family background too. Yes, how do we contribute in our own little way, in our own little quarter to see that yes, we reduce the degree of mentally unstable people in our environment. That's one of the reasons we are having these sessions, and of course, that's why we are having a medical personnel from joining us, which is just around a whole lot of children. Yes, a whole lot of children, a whole lot
Thank you
of
so much,
people,
Onoja, for that.
and then of course
Thank you.
a psychologist, and of course
Yeah.
we have a lawyer who is our co-host, and people that deal with human beings, and of course music too, because music is one thing also that also contributes to our mental well-being.
Thank you so much, Onoja, for that. And I'm going to add to it like it is important that we understand and get awareness on mental health because if we don't know what
Yes, so
we
over to
have,
you.
can't get we can't get the solution to our problem. And also it reduces stigma. When you have an awareness of mental health, you have a different approach of how you interact with people with mental health issues and also early intervention, and we can get coping mechanism to maintain our relationship with people in our society to have a peaceful relationship. Another thing I want to remind us is there was 16 days of activity that started against gender-based violence that started on the 26th of November and ended on the 10th of December. It is important that we eradicate gender-based violence, especially on women and girls, because they are said to be the most vulnerable persons in our community. So it just ended. We just feel like it is important for us to be aware of this because mental health in family setting can affect women and children as well, and it can lead to depression, trauma, anxiety, and so a lot of things. Our psychologists can attest to that. So before we get into introducing our special guest, I don't know if Onoja is still here. He's off having issues with his network. So I'm gonna take this opportunity to have like an icebreaker thing. So I'm gonna ask a question that I want us to like talk about with just one word. Like I'm gonna ask a question and you tell me what comes to your mind. So I'm gonna start with myself. So what when you hear the word mental health, what comes to your mind? I'm going to say Terah because he's the only psychologist I know so far. So that's an example. So you can use one word and tell me, if you hear mental health, what comes to your mind? It doesn't have to be from your field, but from your own personal perspective. When you hear the word mental health, what comes to your mind? I'm going to start with the doctor.
Okay, it just simply means somebody that is mad. That's the first thing that comes to my mind.
So is it
Thank God for
coming from,
medicine, though.
yeah, is it coming
Now
from
it's
your
coming
own
from my own
personal
perspective,
perspective?
actually.
Wow,
Yes, my own
that's
personal
interesting.
perspective.
Interesting. What about you, Z? What mental health? What comes to your mind? Can you hear me, Z?
Yes, I can hear you. When
Yeah.
I hear mental health, what comes to my mind is people are going crazy or a crazy person, somebody with a psychological or mental disorder.
Oh dear, interesting as well. Okay, Onoja, what
Yes.
about you before we hand it over to the psychologist? Onoja, mental health, what comes to your mind? I don't think he can hear me. Anyway, the psychologist, Terah, mental health, what comes to your mind? Like from I can take from your personal perspective or
Of
from your
course,
own.
there is a whole lot that comes to my mind. Can you hear me?
Yeah, this Onoja.
Can you hear me?
Yeah, I can hear you. With one word, what comes to your mind when you hear mental health? One word, just that. Okay, I'm gonna go with Sarah. Tara, mental health. What comes to your mind?
Well, let's put my profession aside. What comes to my mind? Mental health is craziness.
Yes.
It's craziness. Interesting. So this is
Yeah.
very important. Based on your field, mental health. What comes to your mind then?
Based on my field, what comes that is healing.
Okay, that's interesting. That's interesting. Anata, I don't know if you can hear me. So I'm gonna go straight to the session of introducing our special guest, and I'm gonna be reading Tara's biography. This is very important. This is to show you that we really appreciate you and you are doing something good to the society. You know this, and you are giving it back to the society, which is good. Creating awareness on mental health is very very important because it makes your relationship with people more reasonable, peaceful, and then you have awareness on this, which is very important. So I'm going to start with Terah Micah. So pardon my pronunciation, like I'm a Taraba person, and I'm going to read your biography. So Mr. Terah is a mental health advocate and the executive director and founder of Terah Micah Foundation, which focuses on mental health, behavioral, and psychological issues in sub-Saharan Africa. He's also the president of the House of Terah Consult, with nearly a decade of experience. He has supported over 15,810 individuals, including IDPs, refugees, and vulnerable populations, both directly and indirectly. This work has distinguished him as a leader in impactful intellectual resources and positive change in various communities in Nigeria and beyond. Mr. Terah holds an MSc in clinical psychology from the Nigerian Defense Academy in Kaduna, NDA, and a BSS in psychology from Africa University in Zimbabwe. He's a member of the Nigerian Psychological Association, the Nigerian Association of Clinical Psychologists, and the International Society for Substance Use Professional. Interesting. That's about Tara for now, and later on you're going to hear from him. Thank you, Tara, for having you. It's a pleasure.
Thank you. It's a
So I'm
pleasure
going to
too.
hand it over to Onoja. Onoja, can you hear me? Onoja, can
I
you hear
think
me?
Nota seems to be having a twitch with this network.
Yeah, okay. I'm going to read Zainab's. Zainab Yusuf is a proud indigene of local government.
Hello,
Can you hear
can
me?
you hear me?
Yeah.
Yes, I can hear you.
Please, can you go ahead and read Zainab's biography for us, please?
So you can hear me, right?
Yeah.
I think Onoja, I think
Hello?
you should change location. You should change location, Onoja.
Okay, I will continue with Zainab's biography. Zainab Yusuf is a proud indigene of local government in Taraba
Me.
State, born and raised in the heart of Nigeria.
Hello?
Zainab's early life was marked by a taste for knowledge and a passion for learning. She began her educational journey at Modern Primary School in Jalingo, where she laid a foundation for her future academic pursuit. She then proceeded to the Federal Government Girls College, Jalingo, for her secondary school education, where she excelled in studies and developed a strong sense of discipline and determination. After completing her secondary school education, Zainab attended the prestigious Taraba State University, um, where she earns a bachelor's of science degree in political science. Her time at the university was marked by academic excellence, leadership roles, and a deepening passion for learning and personal growth. Today, Zainab remains committed to lifelong learning, continually seeking out new knowledge, skills, and experiences that enable her to grow both personally and professionally. Or not if you can hear me. Hello? Or not, can you hear me?
Just go ahead,
I
Hassi.
can hear you.
Okay. Can you go ahead and read the doctor's biography, please, if you can hear me? Hello? Okay, I'm going ahead to read the doctor's biography. Dr. Prince Militus is an indigene of Karen Lamy, the local government in Taraba State. Dr. Prince is employed at the Federal Medical Center in Jalingo as a senior medical officer in the Department of Obstetrics and Gynecologist. Following the completion of his housemanship, he completed his youth service at the Specialist Hospital, Jalingo, where he was known for his exceptional commitment to the medical field. He is a graduate of the University of Maiduguri, where he obtained his Bachelor of Science and Surgery. He attended Model Primary School, where he earned his first school leaving certificate and then proceeded to St. Peter's Minor Seminary in Yola for his secondary school education. Dr. Prince is passionate about the welfare of his patients in spirit and soul, body. He is married to Mrs. Landy Militus, and their union is blessed with two handsome boys, Nkukufi and Mikanafi. That's all for Prince. Thank you so much. Like I said, you're gonna hear from them in some minutes. So before then, we're gonna go into the live session, which is the main reason why we're here. And the topic again, please, if you're listening, our audience, please don't forget to leave comment, questions, contributions on the comment sections, and we are gonna read it out. And the expert here, the doctor, the experienced teacher, and of course our psychologists are here for you to answer. Um, so before then, I want to know or not, can you hear me? So we're gonna start with the doctor. We're gonna start with the doctor. Zainab, welcome back. I'm sorry about your network. I'm really, really sorry about that. Yeah. So we're gonna start with the doctor. And uh my question goes to you. From a medical can you hear me?
Yes, I can hear you.
Okay. From a medical perspective, how do you think community support can impact the treatment and recovery process of patients with mental health
I can
conditions?
actually hear you.
Okay, can I go ahead?
Yeah, yeah, you can go ahead.
Right. Good afternoon once again, everybody. Let me start by commending the conveners of this Image Taraba. It's a great platform where we usually come around to discuss issues that pertains our welfare and our growth. So you asked a question on how society will actually affect recovery of patients who are suffering from mental health. Now, shockingly, during the course of my research, while I was preparing for this presentation, I discovered that there is a lot of shocking revelations when it has to do with mental health. One of the revelations I came across was the fact that every year, statistically, over 20 million people come down with mental health, one form of mental health or the other. Then, of these 20 million people, about 10 million people attempt suicide every year as a result of one form of mental health or another. And then 800,000 people die every year as a result of one form of mental health or another. Now, shockingly as it may be, these problems don't just evolve overnight. It's a constellation of problems that has been there over time, ranging from anger to depression to aggressive mood, obsessive compulsive disorders, psychological or psychotic tendencies, and then depression sets in. And before you know it, suicidal tendencies begin to build up, and then suicide eventually evolves. Having said that, where we address this issue is usually at the point of the community. Now, the community starts with the family. Some people also in my research, it was shocking to me that one third of the patients that usually come down with mental illnesses usually develop these mental illnesses from age 4. That's shocking, isn't it? And this is owing to the fact that as a result of how parents get to treat their children, or how the husbands get to treat their wives. So the society usually starts as the entity is the family. So the family is the main focus. Why some children usually develop this mental health. And then they went further to say that two-third begins at the age of 34. Now, the reason attributed to that was the fact that at that age, somebody has gotten married and has settled down, or he has been left alone to wallow in the streets, or what we call maturity or adulthood, as the case may be. So, I've come to realize that there are impacts that one should be able to make in his child, at the level of the family, at the level of school, at the level of religious places, at the level of the hospital. The hospital is usually the last resort that usually patients usually come to. But at the family level, it's important that parents should checkmate the lifestyle of their children and ensure that other habits of neighborhood does not inculcate into their own children. Am I audible? Can you hear me very well?
Yeah, yeah, yeah.
Okay. Then at the school level, it's important that advocacy, school advocacy with relation to mental health should be included in our curriculum. Funny enough, during the course of my training as a student, both in my primary and secondary school, there has never been a session on any mental health advocacy. So it's important that at school level, there should be some form of advocacy. Mental health courses should be introduced. I'm sure Zainab will tell us more about that, so that children will learn to fulfill their potentials, will learn to cope with normal stress of life, so that they can be more productive, and then they can participate meaningfully in the community projects. Then the the churches, the religious bodies are also another cycle or niche where we can actually help people during the course of the sermons. That is why it's important that our religious leaders should equally have a background and knowledge of what mental health is all about, so that during the course of their sermon, they can be able to at least impact to their population, so that they will know what mental health is all about. Then Symposiums and seminars should be organized at our various places of work. I understand that in some climes in the world, when you are going on holidays, there's usually a session for you where you meet your clinical psychologist to get to meet and discuss how you intend to spend your holiday, how you intend to actually live the entire holiday before coming back to work. And after holiday, you also engage with this clinical psychologist where you get to meet and discuss how you can go about your work, having had a holiday before coming back to work. So at last level, lastly is the hospital, of course. When you come to the hospital, of course, you must have been symptomatic. We try as much as we can to know how we can help you. It's just advocacy, counseling over and over again. And if it exceeds the level of counseling, of course, we have to place someone on some form of antidepressants or antipsychotic medications, as the case may be. So these are
Yeah.
my few lines of summations.
Yeah, thank you so much for that detailed explanation. I like that you were able to like focus on the family, religious our religious institution, which is where like it's really really intimate sentiment for every family and our personal beliefs. Thank you so much, doctor, for that insightful explanation from the medical perspective. Thank you so much. So I'm gonna hand over to my the psychologist, who is Terah, and his question is okay. In what ways do you think community support can contribute to the overall mental health of individuals facing mental health challenges in Taraba State, especially because our focus is globally, but we want to start from home first. Charity begins at home. So, what do you think about that, based on your experience of work?
Hi, good afternoon again. So, what role will the society play? Well, the society has every role to play in terms when it comes to the issue of mental illness. My very good friend has elaborate much more or has given a good background or introduction to the whole concept, and so I will not dwell much more on that. I will advance on what he had said. So mental illness, like we all started saying, what comes to mind when we hear mental illness? Some of us were saying craziness, some of us were saying mad people, and the rest of the thing. And all of this is not coming from the individual who is having the problem, but then the society. And
Mm,
when someone is being said to have mental illness or has some challenges, is a problem. So there's this, just to add, there's a statistic by the World Health Organization that they are saying, according to statistics, that at least 1 out of 4 individuals across the globe have experienced at least a mental disorder at a point in their lives. So when we hear, we think that it is just that, oh, it is when you are picking garbage on the ground, or when you are there looking all tattered and looking all shabby. That is when people will tag you as having mental illness. So I would start with some few. There are childhood disorders, mental disorders that has to do with neurological disorders, where you have cerebral malaria, which will also cause some of the neurological disorders and other behavioral disorders. So now, permit me, I will, it's Mune Duka. I would be using Hausa while I'm also speaking in the English so that we can carry everyone along. So there's this instances where when a child is doing something, we will say, "One yaron gagarere ne." Or sometimes we'll say, this boy is very, very stubborn.
mm,
Now there are some developmental disorders that has to that affects a child's neurological development, particularly when we talk about ADHD, which is attention hyperactivity deficit disorder. um, this is a disorder that the child does not stay in a particular place. Next minute you're saying stop this, the next minute the child is there, and then you'd also always be beating the child, saying the child is having it's the child is stubborn, not knowing that some neurological disorders that may be wrong with the child. And there's also dyslexia, there's also autism spectrum disorder. All of these disorders are what also push. So how is the role of a society? The role of a society, there's a meeting I just dropped with discussing on stigma, and we were trying to see how stigma has affected a lot of people who have had mental disorders. So the thing is, mental disorder, if you don't have, for instance, if you don't have with the way the economy is going, and maybe your salary is 30,000 naira and you have 5 children and you don't have any source of income, and every day people are just seeing you keeping quiet without saying a word, you want to isolate yourself, you want to binge. If you see any way you can see alcohol or any other substance, you want to take it. Or when you lose focus or you lose concentration, now mental disorder is wrong with you, right? So it doesn't have to be that you're moving around looking all shabby and crazy that it means that you're having a mental disorder. So there are different components of this. And the role the society plays is that if they support people who have mental disorder is just like any other disorder, that you would say openly that, oh, I have ulcer, or I feel neck pain, or I feel headache, and people would want to support this person in trying to access medical health care. But when someone is saying, I feel like I'm going crazy, everyone starts running away from this person. Even the friends will start saying, oh, I'm afraid this guy is going to kill me sometime and whatnot. And they start being marginalized, they start being discriminated against, and the stigma also falls into play. So it is important that the society understand that people who suffer from mental illness require extreme support, and this support is what helps and builds their resilience and coping mechanisms in the recovery process. So basically, I know we are going to discuss further on this, but basically this is my own take for now.
Thank you so much, Sarah, for that. Thank you so much. I like that you were able to focus on, okay, right where it starts from childhood, which is very, very important. Some of us, like, we had no, even our parents, they don't have this information. And that reminds me of what Prince said. Like, we also need to focus on the family setting as well. Parents need to checkmate what is happening around. But my follow-up questions, this goes to, like, all of us, we can have a conversation about this, is I know the doctor, you mentioned about sensitization. It is important for parents to know that. But some of our parents, like, they don't really have interest in doing that. So we can't rely on them to do that. So it's like we have issues. We have identified some, they don't even know, some they even know, but they don't want to do anything about it. And it's going to be transferred to the children. So you end up having generations upon generations that like they are not open-minded to things like that, and it end up traumatizing the child. I had the same issue. I'm not here to give up, like, to say things about my family or something like that. But at this age, I realized that, okay, there were a lot of things my own parents were not aware of. So I don't have to blame them. I have to do the work by myself to see how I can change the situation so that it doesn't end up affecting my own unborn generation. So I'm glad that you all touched on that aspect, the family setting, and then the religious institution as well. Thank you so much. I'm going to hand it over to Zainab now. Zainab, can you hear me? Zainab, can you hear? Or Noja, can you hear me? Okay, I'm going to read out Zainab's questions, and then we can all, like, have an opinion on that. So her question is, as an experienced teacher, how do you identify signs of mental health issues in students? And do you think collaboration between teachers, parents, and community support will effectively enhance the mental health supports available to students, if any, especially in times of bullying? So the floor is for all of us. Onoja, if you can hear me, you can say something. The doctor, if you can hear me, and then the psychologist as well. So who goes
Okay, go
first?
first. So when it comes to this aspect, just like I was saying earlier, you know, it is important that we understand that there are cues that will give, if that will give, because there is developmental, like in developmental psychology, which is from birth to cradle, that we would want to check through. There are some instances where a lot of times, let me be honest with you, a lot of times parents do not really have time for their family because everybody is hustling. So by the time you're back, maybe the children are asleep and whatnot. So you don't keep close attention to some of the behaviors and what they see. So it is important that parents are in the children's life to really know, to understand the development. What are the early signs? So there are a lot of the different causes of mental illness, which maybe let me say four. So there is the genetical or the biological. So the biological is it has to do with um, the components, the chemistry, the chemical upnot in the system, how a person can have mental illness from um, the biological component of life. There is the environmental component, which is according to what you see, what you hear, and how you do things. Say, for
Tara,
instance,
Tara, sorry.
okay,
Zainab, can you hear me? Zainab, can you hear me?
Yes, I can hear you now.
Okay, I think sorry, Tara. So your question, I don't know if you
no problem.
yeah, let her talk so that because of her network. Can you hear
Okay.
me? Your question, yeah. As an
I
Yeah.
can
experienced
hear you.
teacher,
Go ahead.
yeah, your question as an experienced teacher, how do you identify signs of mental health issues in students? And do you think collaboration between teachers, parents, and community support will effectively enhance the mental health support available to students, if any, especially in terms of bullying and stuff like that?
Okay. Good afternoon again. And I'm still Zainab Yusuf. Thank you for giving us this platform to like discuss and make something insightful out of it. So it's very, as a teacher, you're supposed to know each of your students personally. So it's really easy to identify when there are changes in the students if you know them. So if you don't know your students, but on personal times, it means you're not even a good teacher. So you're supposed to know them. And then when you see the changes, you notice. As students struggling from mental health, there are certain things that you will notice. Number one, you see maybe withdrawal, they would withdraw themselves from other activities, either playing with students, their colleague, they'll just withdraw, they will distance themselves from other social activities and even academic activities. Then there is aggression. Some of them will be very aggressive towards their colleague, towards their classmates, their friends. And then
Mm,
there is, yes, truancy. Some of them will be running away from school. They won't like to stay in school. And then there is also clinginess. For the little ones, those 5, 6, 7, there is clinginess because they may they lack that love or attention from home. So they will be clinging on to their teachers. They will cling on to their teachers. They will cling on to their teachers because they're seeking attention.
mm,
And then there is decline in grade, especially when they are doing good. You see that their grade is dropping. They will lack interest. And if you see all these things and if you ask, you realize that there is one or two problems having either at home or in school among their friends. Sometimes these things are triggered from right from home. In other cases, Anna Magana, please keep quiet. In other cases, it's among their friends. There are a lot of cases like that. But when doctor said it starts right from age 4, I wasn't surprised because I taught students in earliest nursery right from age 3, 4, 5, 6. And then you will notice all these changes in them.
yeah.
Are you with me?
Yeah, yeah, we're listening.
Mm.
We're
Yes, you
listening.
will notice all these changes in them. In fact, even eating. I had a student who, like, I noticed some changes in her from her behavior and everything. And when you ask, you realize that there is something. It's just something as small as her mother is not at home. Her mother traveled, and then
Mm.
it showed in her completely, from her behavior, from her grade, from her mode of eating. Everything changes. Do you understand? So these are the things that you notice in students regarding their mental health. And then again, the school organization or the school environment is tripartite in nature. It involves the student, the teacher, and of course the parent. So when you notice something, the best thing or the first thing you do is talk to that parent, bring them into the picture, because most at times, or some of the times, these students are even closer. They open up to their teachers more than they open up to their own parents at home. So as a teacher, you play the role of a parent. Are we
Yeah,
together?
she's.
Are we
Mm,
together?
Yeah, we can hear you.
yes, we
See.
can hear you.
Okay. You play the role of a parent, a teacher, a counselor, a friend. All these things is on you. So when you notice all these things, you first involve the parents, because you cannot do it alone. The parent cannot do it alone. It has to go from parents, teacher, students all together to get what we want. Then you get them the necessary help that they need. Some of these students, those in secondary, they open up to you more than they open up to their parents. And even bullying, because some of these children, they feel okay by being bullied to their colleague or by bullying fellow students, is where they feel seen or recognized, or how
Yeah,
they vent their own anger. Are we together?
yeah.
Yes. So I think that's it.
Thank you so much. See, honestly, your what you are saying just reminds me of how I was bullied in school. I still have the memory in my head. Honestly,
Yeah, it
um,
will
um,
mess you up
and
right
I'm
from that
so
moment.
yeah, and I'm so glad we have you here to be part of this discussion. Thank you so much for that. Thank you so much. So if from the audience, please, if you can hear us, you can leave your comment, questions, contribution, anything, you can leave it on the comment sections. Onoja is right there to attend to you. Onoja, can you hear me? Onoja, can you hear me? Okay, thank you so much. I guess it was such uh, an eye opener session, honestly, hearing from the doctor, the psychologist, and the teacher. Oh my God, thank you so much. So there's this I want to ask like, can you hear me? I want us to
Yes, we can
share
hear
our
you.
experience. Like, I'm gonna call some words that I want us to share our experience with it, because we believe it is very common with us, with our friends, family, place of work, and something like that. So you can share your experience in 2, 3 sentences with that. Your experience with depression, your experience with loss, anxiety, disappointment, and yeah, depression, trauma, uh, anxiety, and stuff. And we need to have it in mind that when it comes to mental health, it is a collective responsibility. Our families, this institution, place of work, and then the government, and of course the hospital. So before we go into the question, life Q&A, please can we share our experience with depression, loss, anxiety, and disappointment in 2, 3 sentences, please? Onoja, can you hear me?
And I just seem to be having a network twitch over there.
Yeah. So we can start with you, Prince. Your experience with depression, anxiety, disappointment, and loss.
Well, let me start with depression. You know, as a medical doctor, my area of specialty is usually the women, and most times the most common complications or mental health problems that we face is with regards women that come to deliver and experience what we call postpartum depression. Now, of every 10 women that deliver, it has been shown that 8 of these 10 women come down with one form of postpartum depression or the other. Now, this ranges from postpartum blues to depression to postpartum psychosis, and the length of complications keeps on progressing till it gets to sometimes even schizophrenia. Now, you mentioned earlier about community support. Now, it has been found also that the real cause of this postpartum depression is unknown. However, some of the articles postulate that improper or inappropriate care of the parturients of patients that just delivered usually contributes to the fact that these patients develop postpartum depression. The reason why they develop it, we don't know. But you see patients manifesting with, they don't even like their babies. They feel like killing themselves. They are not happy with the fact that they have delivered, and so many crazy, crazy symptoms. So once you begin to sense that, you know that postpartum depression is beginning to set in. So at that point, of course, the hospital is a holistic environment. You have to invite the clinical psychologist to come and talk to the patient, counsel the patient, and if counseling is not working, you have to involve the psychiatrist to come and place the patient on some form of antidepressants to be able to cope with that stress.
Thank you so much. Thank you so much. But from your own personal experience, can you say in maybe one sentence or two, like what has been your own experience with that
Well,
personally, considering the type of work
mine,
you do?
yes, mine is fatigue. You know, from time to time, our work is very demanding. It's time
Yeah.
demanding. You leave work very early in the morning. You come back very late at night. An average doctor works like 7 to 8 hours on an average. Then you have to take calls that starts from about 4 p.m. till the next day. And after which, you still have to work till evening before you come back home. So
Yeah.
there is that burnout. You're
Yeah.
burnt out, so there is that anger mechanism comes in. The stress leads to anger, and then you cannot afford. For some of us that know that it's actually the working environment that is making us have those symptoms, we cannot afford to transfer it to our families. So you begin to just isolate yourself. The
Yeah.
anger will lead to some form of depression, and then before you know it, some form of suicidal tendencies will even be coming up at times. So it's very, very disheartening that some of us encounter this ourselves. But the good thing is that some of us are very aware of the fact that these things could be some form of psychotic problem or mental health issues. And once it
Yeah.
begins to set in, we just try to do other things that will help us to come out of it. For me, I
Thank
have
you
Netflix.
so.
My phone is there for
Yeah.
me. My boys are there. My wife is there to help me. So I have a
Yeah.
lot of support from my own community.
Thank you so much for identifying that the awareness is what is important. If you know the issue, you know
Yeah.
how to handle that. Thank you so much, Doctor. So, Tara,
Thank you
the
for having me.
psychologist. So, what has been your experience with depression, loss, anxiety?
Okay, so well, so this is gonna force me a bit to talk about my but don't be comfortable discussing it. So and so in while I was in had I was diagnosed with anxiety disorder in my life. How did this happen? So after we went to science secondary school, from there we wrote WAEC, first year, second year, third year. I wrote WAEC, I think, up to so it or indifferent about um vision of being. I was just numb. So and then I had another thing that clicked, but then it crashed. So to university, and then in my first year in the university, I set some very important goals that I set. I want to five of them, and so this is what happened to me. So five of all of this set goals, all of them worked in within 2 weeks. All of the five goals now was like perfect, and so I became very anxious. I could not manage success. So how did this affect me? It did in a way that I could not. Anytime I just feel I want to do something, maybe it is going to take 5 years. My brain will start racing and tell me that I can do it in like 5 days. So I will start trying to do all I can to achieve that in 5 days. Sometimes I will go 2 weeks without having a. So over a period of time, it has started affecting me. I could not concentrate. Any simple thing, I just like I can achieve it, and when I don't achieve it, it becomes a problem for me. And so, how did I get out of this? First, I started using journaling. I started doing more of exercises. Thankfully, I wasn't abusing substance. I started doing other things, meditation. Right now, I've even graduated from meditation. I do mindfulness, which is more deeper than meditation. So it helps a lot for me. So that is how I have done. But then, quite of recent, again, my place, just like Dr. Militus said, my place of work, I am a bit far away from my family. So with that, it messes me up sometimes, you know. And then, but one of the things that I've identified is patience and be coming down, and then also have a zero pressure level. So whatsoever that comes, if I can handle it, fine. If I can't, then it's a zero pressure for me. So it has helped a lot, and that is my experience. Thank you.
Thank you so much. I really resonate with what you just said, honestly, but I'm not going to go into details. It's good you are aware and you know what to do. That's your coping strategy, which is very, very
Exactly.
important. Because so many people go crazy, and that's why you see people taking in this uh, damaging substance into their body because they can't cope. And we tend to blame them. It's because they don't know what to do. And when you get into that, it's quite addictive, that it's highly unlikely you get out of it without self damaging, honestly. But thank you so much, Tara, for that. So Zainab, what has been your experience with loss, depression, anxiety? If you want to share 2 3 sentences before we finalize the session. If you can hear me on the audience, please, if you have comments, like questions, contributions, you can put it down on the comment sections, and our experts are here to answer you. Zainab, can you hear me?
Yep, I can hear you.
Okay. So, what has been your experience with depression, loss, disappointment?
I can say I don't think, even though I'm not a professional, I don't think if I've experienced depression or, but what I know is I've experienced loss and it affected me seriously when I lost my sister. You know, you're grieving. So like when I see people happy, I go like, why are they happy? Why are they experiencing depression? So I don't think if I've experienced depression or, but what I know is I've experienced loss and it affected me seriously when I lost my sister. You know, you're grieving.
Zainab,
So
can you
like
hear
when I
me?
see people
I
happy,
think she's off again. So
Yeah.
once again, Anota, can you hear me? Okay, I'm gonna hand it over to Onoja for our closing remark. But before then, I would like to summarize the session. So, as you all know, our topic for today is the role of community support in mental health. We had our conversation on mental health, considering the perspective of medical aspect, the psychological aspect, and from an experienced teacher. And it has been Very interesting. I've learned a lot from here, honestly, me personally. There are things I don't know, but hearing from these three people made me realize that I need to work really hard on my mental health as well. And we know that it is a collective responsibility. We have to be in it together. It's not just one person. All of us are involved. And whenever you find yourself struggling, depression, anxiety, whatever, you need to be aware of it and accept things the way they are and do what you can to change it if possible. But if you can't, you have to let it be so that you can maintain your mental health well-being. So I'm gonna how Onoja, can you hear me?
Yes, I can hear you.
Yeah. So if you can read from the comment sections, maybe comment questions so that they can our expert can attend to that, please.
All right. I think one of the surprising thing, one of the reactions I saw on the comments was somebody reacting to the fact that one of our panelists here said, mosquito can cause mental disorder. Can you throw more light on that?
What? Mosquito? Hasi, did you get the question?
No,
Yes.
Onoja, can you repeat yourself? Like, is it the one? Do you know what that malaria can cause mental disorder? Is it that? I think with that, if you are affected with malaria, it's gonna affect your mood, right? You can be depressed because you're not yourself. You're not getting that your cheerful, healthy self. So definitely, it's a mental health issue. As minor as it is a mental issue. Like from the beginning, I know from our own personal perspective, we said when you hear of mental health, what comes to your mind? We said crazy, mad people or something like that, but it's more than that. You see, it's more than that. We all have experienced mental health in one way or the other, but we don't just know that it is mental health issues. We all know that I can wake up today, I'm not happy, I need to check myself, what is the issue? Something, maybe anxiety, depression, or even disappointment. I call a loved one and it's not picking my call, I'm experiencing mental health issue. You just have to identify which mental health it is that, and then you have the coping mechanism that can help you. And that's why we have sessions like this to help us understand the issue of mental health. Very, very interesting. We need to take it seriously. And then wherever we find ourselves, we need to educate people on mental health. It is not just about people that are crazy, people that are taking things, especially it's very, very common in Nigeria, in Taraba, in Jalingo, in the city of Jalingo. I have someone dear to me that is also having the same issue. When they can't cope with the pressure of life, they get themselves into taking substances that is capable of destroying their self organs. So thank you so much for that section. I'm going to read some comment from the comment section. There's a question: how do I prevent mental health disorder or depression? So if you have, you can answer that. The
Okay.
floor is
Sorry, I had a little glitch, but I'm back. So, to respond to your question, how do I prevent mental health disorder or depression? Um, well, before you would say you have mental illness, we do assessment. So we assess, and then after the assessment, then we would categorize the kind of mental disorder, and then see what options are available for you. So this will help us in killing it if it is a mild, moderate, or severe type of disorder. If it requires medication or it requires therapeutic sessions. But anyways, particularly the depression, or all of them, you need to speak with a professional. It's very important. That way, it is going to be identified. There are numerous types of mental disorders, so it will help in identifying such. But with depression, you should do more of being around people. Don't isolate yourself. do more of exercise as much as you can. It doesn't have to be a 30 minutes, even if it is a 2 minute exercise, it is something. Also, if you can read books that will inspire you, it will help you out. Also, just I operate a consult. In this consult, we also provide services, therapeutic services. This tailored at making sure that people who have mental illness um, are being taken care of. And so this it does not necessarily we have a platform of teletherapy. This teletherapy, we can do the sessions online, not necessarily being physical. We can have the sessions online, and as well to discuss further on what is actually happening to you and how we can together with you, because we do not have the solution. For everyone who has the problem has the solution to the problem. So our role as professionals is to guide you towards getting the solution that you already have within you. So we just guide you to that. Thank you.
Thank you so much, Tara. Thank you so much for that. Zainab, I don't know if you have something to add to that. Can you hear? If you have something to say, oh, I'll give it back to Onoja. Onoja, can you hear me?
I can hear you.
Yes, I can hear you.
Do you have something to add to what he said?
No, Tara is the professional here. I
Okay,
Yes,
even
whatever
have a
you.
like
question for him.
Okay.
Yes. So Tara, can you hear me?
Yes, I hear you.
Okay. So like a person that is dealing with drugs, like has drug addiction, yeah. So how do we go about it? Can
So the issue of substance. Thank you for the question. The issue of substance. I will not lie to you. A
yes.
lot of young people in our community in Taraba, if we not lie, give ourselves. We know that a couple of people are trying to escape. So this is what substance does. You have been traumatized by something. It could be anything that has that trauma now. Okay, the way our brain functions, when we have our mobile phones, yes. So when you have your mobile phone, you are with a group of friends, and then you took pictures. Someone snapped a lot of pictures. Now, after these pictures have been taken, so you post, you come on. So what you do is just these pictures and see the one that you look beautiful on first, not the ones that other people put on them. So the ones that you look good on, you select them. Now, after you've pre-selected those ones, you would want to start looking at the ones you want to post. Now, that is when you start considering that, okay, does Hassana look good in this picture? Is everyone looking okay in this picture? And you say, well, so beautiful. Okay, Hassana is not closing her eyes. Onoja is smiling, is not looking away. Okay, this is good. So the ones that you don't want, delete all. So when you delete them, they go recycle bin. Now, in your recycle bin, there for a period of 30. So after that 30 days, they delete. But sometimes you go to that recycle bin and delete those pictures permanently from the phone. Now, this is with mobile devices. The way our brain functions is that any trauma or any adversity that you have experienced in life, the brain cannot be. Oftentimes people say you can forgive and forget, right? I always say you can forgive, but you can never forget. Now,
We'll
how
have
does
to.
this happen? Is
Hello?
because it is. Can you hear me?
Yeah.
So it is in your brain. You and that trauma is what is making people want to go any substance that it numbs functioning, some of the cognition. When it numbs it, makes it look like forgotten about the problems or the sorrows. by the time they are becoming sober, coming out of the addiction or coming out of the substance, that same memory is coming. So by the time it is coming back, they want to still go back and take that so that it will continue numbing the trauma that they are running away from.
This is quite
Right?
interesting. We're gonna give if you have any, this is very interesting session. If you have any issue of mental health, we can share Tara's details to you, and then you can chat with him privately, because mental health issues is very, very important, and we all need to have that awareness so that we can help ourselves and also people around us. Thank you so much, Tara. Such an interesting conversation. The doctor, do you have anything to add before we get
Yeah,
to the end?
well, just to add, it is important that, just as my brother Micah said, that some of these mental illnesses, you cannot prevent them. Some of them are
Yeah,
genetically inclined. Some we are born with them, like all those unipolar affective disorders, schizophrenia. There are problems that we usually come as a result of maybe some nerves or fibers misfiring in our brains. So some of them we cannot actually prevent them. They are in us, but the most important thing is to identify them and seek for help. A typical example of another mental disorder is obsessive compulsive disorder. Patient
yeah,
will present to you, and the only way you know that this person has some form of mental illness is ability to not stay in a dirty environment. They don't like the dirty places. They cannot use toilets that somebody else has used. If you enter their room and you're going out, you see them carrying broom and try to sweep. Some cannot even marry because they are scared of living with a person that will not come and make their house look tidy. So these are some of the
issue.
diverse
OCD,
mental
right?
illnesses. Yes.
Yeah,
So some of them are actually not preventable. So the most important thing is to identify them.
and
Lastly,
manage.
before I close, yes, I manage them. It is important we understand that the global disease burden has allocated 28% of neuropsychiatric disorders as the highest in the disease burden of all the diseases in the world. Now,
Yeah,
it will shock you that things like hypertension, diabetes, cancer, musculoskeletal problems, they account for only a fraction of problems that has to do with our disease burden. Just neuropsychiatric problem alone accounts for over 28%. So it's actually
wow.
that huge. So it's important that we have ourselves checked on a regular basis, maybe at the beginning of our holiday or at the end of our holiday. It's
Yeah.
important we meet a clinical psychologist or a psychiatrist to actually have a mental evaluation of ourselves before we even start anything talking about work.
Thank you so much, Doctor. Thank you so much. Thank you so much for that. Thank you so much, Zainab. Thank you so much, Tara. It was such an insightful conversation, and we are really, really honored to have you all here with us. So, to our audience, we're going to share. If you have questions, you can reach out to us privately, to the doctor, to Zainab, and to Tara, the psychologist. We've now come to the end of our session. And I want to use this opportunity to thank each and every one of you here, both our within the studio, and then at the back of the studio, our audience on the comment sections. Thank you so much for your time. Thank you so much for your time. And I want to use this opportunity also to announce that our next section for next month is going to be in January 25th, same time, same venue. And we look forward to seeing you. Thank you so much. And Onoja is not here. On behalf of the entire team of MH Taraba, I want to thank you for honoring our invitations. Thank you so much. And we believe that people out there are going to learn from our conversation. We may all be advocate of mental health. If you see someone struggling, please be reasonable, be sympathetic. People are going through a lot. Honestly, you don't know what will come out from your mouth that will help somebody's life or the mood. And be an advocate of mental health. Don't judge and be considerate at all times. So thank you so much once again, Tara. Thank you so much, Prince and the Doctor. It was a pleasure having you here. Thank you.
Thank you much,
You're
Sarah,
most
for
welcome. Thank you for having us. Have a
Thank
great
you.
day.
Thank you all.
Thank you. Bye. Mm,
Thank you as well. It's really
bye.
impactful.
Yeah.
Sarah, I'll talk to you personally.